Good day, everyone. Welcome to another episode of Seco Direct. My name is Dr. Tiwa, and today we're going to talk about a topic that affects a lot of people in the world and especially in Nigeria. We're talking today about osteoporosis. We're going to explore the causes, the things you should avoid, the things that could make it worse, and how to protect your bone health. We had initially started about going to do bone tests, but now with this condition, we're trying to tell you what you need to do in terms of being proactive with your bone health. Stay tuned for the episode. So, as we said before, what we're talking about osteoporosis. What is osteoporosis? Osteo or ost is bone, is Latin for bone. Porosis is weakening or thinning of the bones. So osteoporosis together is a condition that is characterized by thinning and weakening of the bones, making them prone to fractures. Now, osteoporosis is a long-term disease. It's something that goes over time. It's associated very frequently with age. It usually occurs progressively, silently, until a fracture occurs. That's why it's often referred to as the silent disease. Most people don't know or don't really look at their bones when it comes to overall health of their body. And they never get to know whether they have osteoporosis or not until something happens that causes them to break a bone. Osteoporosis can make any one of your bones very likely to break, but the most common affected bones are like your hips, your wrists, and your spine. That's hip fractures and wrist fractures and spine fractures. Now, as a doctor, I've seen many patients affected by osteoporosis. They typically are from an age range of at least above 50. And understanding the causes or the risk factors is very crucial in terms of prevention and as well as management. Now, osteoporosis itself does not cause something. It's not like a typical disease. It's not like malaria that causes fever or like an infection that causes something. It doesn't directly cause any symptoms. You might just notice a few changes to your body. Maybe, for instance, maybe when you go down the staircase, you used to be able to land well, but now when you come down the staircase, you sometimes turn your ankle. You just, those sort of little things. Now, those things usually point to osteoporosis in the sense that you start noticing that you might maybe lose an inch or more in your height. You might start noticing that you have a change in posture. Maybe if you feel some slight aches or some slight differences when you move around. Now, another very serious one that you could actually notice is maybe if you have like shortness of breath. This one is very particular to disc in your spine when they are compressed. So they have the tendency to reduce your breathing capacity. And very common one is lower back pain. That's pain in your lumbar spine. So you could notice that you might not be able to notice these changes in your physical appearance, especially losing of height, because your height isn't something you pay attention to until, unless it's extremely drastic. That, oh, you've lost, like maybe you used to be really tall and now you're really short. It's not those kind of changes that happen when it comes to losing your height. It's very slow, methodical, and it's mostly subject to you changing your posture, not being straight when you stand, and all those things. That is usually what you would notice in terms of your height changes. But somebody else can be able to notice that there's something wrong with your posture, especially maybe there's a way you used to stand, there's a way you used to walk, but they would notice that you are probably compensating. For instance, if you have lower back pain, you would notice that for people when they walk with that lower back pain, you would notice that maybe they're a bit hunched forward, or they compensate, they move to one side to adjust to the pain they have. If they walk, if the pain is to their toes, for instance, they walk with the back of their feet touching the ground instead of the normal walking posture. Those changes, you might notice them and think, okay, it's just because you're adjusting to pain, but you wouldn't notice when you've started making it a habit. It's somebody that would look at you and be like, oh, this person, are you sure you're okay? You seem to have changed the way you used to walk. You seem to have changed the way you used to act, kind of thing. So that is one thing. That's why in the management of this osteoporosis, one very crucial thing is having a community around you that understands your patterns, understands the way you do your things, understands how you walk, understands how you posture up, how you sit, so that they're able to pick up on those little minor changes that usually occur when you have this osteoporosis in your bones. Now, but regardless of that, in for you to know whether you have osteoporosis or not, we have to go back to when we did an episode on bone density. You have to do a bone density test. And to do this, you have to go to your healthcare provider and ask if when they do it or how it can be done, or if you want to inquire on prices or anything like that, you can reach out to your main healthcare provider for them to do that. It's a very easy test to do to get your bone density checked. So the causes of osteoporosis are multifactorial. When it says multifactorial, it means there are multiple things that can cause osteoporosis. And they include a lot of things. They include a combination of genetics, your lifestyle, environmental factors. So now we're going to go into each of them and then just give a little short story as to what are the primary causes of osteoporosis. Now, the first one that we're going to talk about is the bone remodeling imbalance. So as you grow older, our bones are constantly being remodeled. When you say remodeled, there are things that make your bone your bone. So when you grow older, old tissue is usually broken down and then new bone tissue is formed. Old tissue is usually broken down and then new bone tissue is formed. Now, if those old bone tissues are broken down a bit slower and the new bone tissues that are formed do not come about as quickly as they normally would, osteoporosis would occur because the bone breakdown, the old bone breakdown, is now faster than the new bone being formed. For if you understand me, it means like normally old bones after a period of time they go away, new bones are formed, new bone cells are formed. I don't want it to come across like, oh, right now if I have a bone in my leg now, after some months that bone will remove from my leg and then that bone will replace it. No, I don't mean it like that. What I mean is your bone is formed by cells. Those cells, old cells, usually die out and then new cells replace them. So if old cells of your bone are dying out slower and then are dying out faster, and then your new bones that are supposed to replace them are not replacing them as quickly as they're meant to, that means your bone density will reduce. That's what I mean. Now, another thing that usually would occur is hormones. Hormones play a very significant role in your bone health. For instance, in women, if there's a decrease in your estrogen levels, that's during menopause, it accelerates your bone loss. Same with also lower levels of testosterone in men. Another example is there is a gland. There's something that usually helps with regulation of calcium in your blood. It's called there's the parathyroid hormone. Is this place here you have thyroid hormone, but there's one behind it that's called the parathyroid hormone. It's behind the thyroid gland. It produces what is called, or it not produces, it regulates calcium. And calcium is usually very good for your bones, if you understand. So calcium makes your bones stronger. So if the regulation of calcium in your blood is affected, it leads to your bones not being as strong as they are meant to be. That's where we now go into nutrition, because what actually brings the calcium into your body is your intake. If you eat a lot of calcium, if you eat a lot of vitamin D, it's very essential for your bone health. So if you have deficiencies in these nutrients, that's calcium and vitamin D, it can lead to decreased bone density and strength. I hope I'm not losing you. Do you understand how each of these factors makes into one another? Another thing that can cause it is medical conditions and your medications. Now, some conditions like rheumatoid arthritis, for instance, now that's a big word. So let me go for something easier. Like I said, the thyroid now. That thyroid disorder, for instance, can cause for your bones to be brittle. How? Like I said, that hormone that's behind your thyroid is a parathyroid. Let's say, for instance, for some reason or another, we have to do a surgery to remove it. So if we remove that gland, it will not be able to regulate calcium in your blood. And then that means your calcium levels can drop drastically, especially if you do not eat enough calcium or vitamin D. That would then lead to reduction in your bone health and increase the risk of osteoporosis. Additionally, the use of long-term use of corticosteroids, that can also lead to bone loss. So moving on, as we've spoken about the causes of this osteoporosis, let's move on to the major risk factors for osteoporosis. Now, so the first major risk factor is age. Our bones are usually dense and very strong enough to support our weight, especially when you're younger. That's why if you are in my field, in my line of medicine, that's orthopedic surgery, you would notice that younger people, whenever they suffer fractures or intense breaks to their bones, the doctors are usually much more comfortable doing the surgeries because they know that the bone will heal as fast as it's possible for them compared to older people. Because when it's older people, osteoporosis becomes more of a factor and the healing process is probably very slowed down. So as you age, your bones tend to lose their density and their ability to regrow. That's remodel themselves. If you notice, when we're talking about the old bone cells and the fact that they die out fast and why we need the new bone cells to replace them as quickly as possible. But here's the thing, the older you get, that process begins to slow down and that makes your bone density begin to decrease. And in this case, it now increases the risk of osteoporosis. Typically, it usually starts at around above 50 years old. Secondly, gender. Women, especially postmenopausal women, are at higher risk of developing osteoporosis. Why? That's because of the hormonal element to osteoporosis. Because in postmenopausal women, there's a sharp decline in estrogen levels, and estrogen usually helps in the regulation of the hormones that help with the bone structure and bone density. So another factor that can contribute to the increased likelihood of someone getting osteoporosis is family history. If you have a father, a mother, a relative that's had a fracture before or has had the family history of osteoporosis, this can increase your own risk because genetics play a significant role in bone health. So another thing also that affects your bone health, your bone density, is your lifestyle. Now, smoking, excessive alcohol consumption, if you sit a lot, can also all contribute to bone loss. Weight bearing and muscle strengthening exercises are essential for maintaining your bone density. Of course, we're not saying become a gym head or carrying a lot of weight and everything. Just making sure that your bones have some weight bearing, just to stretch, just to make sure that they feel they can resist downward force. For instance, you can resist downward force. It helps to strengthen the bones as you grow older. Also, body frame size. Individuals with smaller body frames tend to have a higher risk because there's less body mass to draw from as you age. So if you're smaller, it's difficult for that bone remodeling process to keep on going. And again, like I mentioned earlier, if you have or if you know someone that's had a history of fractures, especially after the age of 50, osteoporosis is almost very likely for the person to have, because fractures usually indicate the rapid removal of your old cells and the need for new bone cells to come in faster. But that's why as you age, when you have a fracture, it takes a very long time for it to heal properly. So because it takes such a long time for it to heal properly, osteoporosis is very possible for that patient. Conditions like inflammatory bowel disease, celiac disease, and other disorders that affect your nutrient absorption can also contribute to osteoporosis risk. Like, for instance, that celiac disease is your ability to absorb calcium. And as I've said before, calcium is very essential for your bone health. So if you're not able to absorb calcium as a person, that would usually affect your bone health and cause osteoporosis. Now, what can I do to reduce the risk? Now, with osteoporosis, I've said it before, things like age and genetics, there's nothing that can be done for them because they're beyond our control. But there's several proactive steps that you can take. And we at Direct, we are all about the proactive nature. Now, exercise. Weight bearing and muscle strengthening exercises, like I've said. You can walk, you can jog, you can stretch. There's these resistance bands that usually you can get. You can put them on your knees and try to stretch them, put them on your legs and try to stretch them. Just make sure that you have forces going against your bone, from small to large, to make sure that your bones are understanding how force is and how to go against that force so that they can get stronger. Exercise is very, very crucial. Lifestyle, as I've said, reduce your alcohol intake, avoid smoking, as both can contribute to bone loss and increase your risk of fractures. Another thing is your diet. Like I've said before, make sure you eat a lot of things that have calcium, like milk, vitamin D, like vegetables, and those fortified foods are excellent sources. You can even consider supplements if necessary in these cases. Go to your healthcare provider, especially if you're at higher risk, if you've noticed that you have family history, or if you're taking medications that their side effects are loss in bone density. Make sure you go to your healthcare provider and do a bone density testing. Early detection can manage and help mitigate the effects of osteoporosis, can help you just understand, okay, this is what I probably have, or this is what I don't have, or this is what I need to do to make sure that it doesn't progress more than it has already done as of right now. Just in a summary way, osteoporosis is a significant health concern. It's something that in some cases is you cannot avoid, especially with age and genetics. But understanding the causes that you can control and the risk factors that you can prevent can empower you to take action and have a proactive nature in regards to your bones. You can very significantly reduce your risk if you go through everything that has been said in this episode and go through them diligently. Maintaining a healthy lifestyle, exercising, eating the right food, staying informed, having your own community, and seeking medical advice when necessary. Thank you again for joining us at this episode of Direct. My name is Dr. Tiwa. If you enjoyed this episode, feel free to subscribe, leave a comment down below. You can reach out to us if you have any questions and topics you would like us to talk about. But until next time, stay healthy and take care of your bones.